Welcome back to the Poisoning Podcast. I'm your host, Erin DeLulo, and today we're diving into one of the most urgent public health crises of our time, the overdose epidemic. My guest is Alexis Pleus, founder of Truth Pharm, as in pharma, PH, and The Trail of Truth, two powerful organizations turning grief into action and pushing for bold policy change. We'll talk about her personal journey, the fight for equity in treatment, and the urgent policy changes needed to save lives. This is a conversation about truth, accountability, and hope, and I'm honored to share it with you. Alexis, welcome to the Poisoning Podcast.
Thank you for having me. I'm happy to be here.
I'm so glad our mutual friend, Ed Bish, put us together. You know, I always love giving him credit where credit is due.
Yes, Ed is great at making connections for people. That's for
Isn't
sure.
he? He's a professional connector. So I want to start our conversation about, translating grief into advocacy. It's been over a decade since you've lost your son to an overdose. And then months later, you founded Truth Pharm with a PH. Could you share how that profound loss shifted the mission and the strategies and your whole worldview with you starting Truth Pharm and the Trail of Truth?
Yeah. When I lost my son, I'm a structural engineer, and that's what I was doing full time. And I have, Jeff was my oldest son. I actually have two of my three sons struggled with addiction. And so our family was really well versed on the challenges of trying to find help, the stigmatization of people who struggle with substance use. And yeah, just the fact that it's easier to find punishment than help, really. And so after losing Jeff, I really poured myself into research to find out, what was going on for other families. One of the places that I found the most evidence was in a grief support group that I joined online. That was specific to overdose deaths. And I was kind of surprised that there was a grief group just for that. And I remember, every single day, these stories and pictures were being added to this Facebook group, and all the stories were just like our families. They weren't really different. When I thought our loss was unique, I thought that trying to find help was unique. And then I learned it was really everybody's story. And that many people like our family faced a lot of stigma, either in their loved one, trying to obtain recovery or losing their life. And so I just set out initially to try to break down the stigma. And I had no intentions of starting anything really big. And 6 months after losing Jeff, I formalized, starting Truth Pharm and named it, but I still didn't know what my intentions were, what the big plan was. My goal was really to educate families so that they could do better than I did, and understand more about the epidemic and about addiction. And so that was the birth of Truth Pharm. It was almost exactly 6 months after losing Jeff. And I thought I was just going to start a little volunteer community group to make small changes here and there. And it really just took over my life. And so when I finished that engineering assignment that I was on at that time, I decided to take a break and really get Truth Pharm going. And that was almost a year after losing Jeff. And I've never gone back to engineering since. I find this work to be really therapeutic. I find it really important. And as long as people keep reaching out and telling me stories that are still just like Jeff's 11 years ago, where people are still struggling to find help, I'll probably still feel compelled to do this work. And so that's the beginning, the origins, and it's always shocking to me. It's been 11 years since I lost Jeff. It feels like yesterday and a million years ago, all at the same time.
Oh, I can't even imagine. And so for our listeners, Jeff's problems started with oxy. Is that correct?
Yeah, he was prescribed. He was a football player and a wrestler. He had a knee blowout in his first game of the season of his junior
Mm.
year. And he was determined. He was such an athlete, he was determined to wrestle that year, and he needed a major knee surgery. And the surgeon said, well, the most important thing is going to be controlling your pain so that you can get through the physical therapy and do everything that you need to do. This was 2003. So no one was telling us the dangers of opioids at that time. We had no idea. The doctor didn't tell us. There was no news about it at that time. And so, I played a role in encouraging Jeff to take his medication on time. If he was complaining about pain, I would ask if he took the medication. And of course, all of that haunts me to an extent because I just didn't realize, it could lead to other things for sure. And for Jeff, I didn't find out for another 7 years after that initial prescription. I didn't find out until 7 years later that he was addicted the entire time.
Wow, 7 years.
7 whole years. Yeah, he hit it really well. He's a bit of an overachiever. He finished high school, went to college, got his own apartment, had a job. He was doing everything right, as far as I could see. And so I just had no idea until things really fell apart for him.
Well, what really impresses me is the congressional testimony you gave. It was
Thank you.
so powerful in advocating for accountability with Purdue Pharma and the Sackler family. And wow, how you balanced your personal grief and while still calling for accountability. It's very impressive. How did you manage that, really?
Thank you. Thank you. I don't often even know. It's in those moments. I remember that I was feeling really heated during that congressional hearing and feeling really frustrated by the dance that a lot of our elected officials were attempting to perform in front of me. And a lot of times I tell people, a lot of times when I speak, I find out what I said afterwards.
You don't remember it at the moment, right? Yeah.
Sometimes it's a bit of a blackout situation. And thank goodness it's not always horrible. But yeah, I just I was getting increasingly frustrated. One of the things that's really fun about that hearing that probably people don't know until they watch it, or know until I tell them, that the gentleman who lined me up to be a speaker, I was texting him and I was just getting increasingly angry about the way the congressional members were behaving, and really, they assumed that my only role there was as a grieving mother, which continuously frustrates me because I've become a bit of an expert on the epidemic, and they just assume that I show up there just to be a grieving mom, to whatever, I don't know. So I was sending him text messages and I was like, get a question to me, like I will respond to this. And so they lobbed a question to me. And yeah, I had been taking furious notes and I was ready. And yeah, I always hope it has an impact. So I appreciate that you felt it did.
Oh, you're welcome. And just remember, those congressmen only know what is in the memos their staff gives them.
So true. Yeah, that's so true.
Or at least for most of them, okay? Let's just be
Yeah.
honest.
Yeah.
So I'd love to discuss with you your viewpoint on our current overdose numbers, which are decreasing and dropping generally. I mean, there are areas like my area, which I've talked about over the last few months, has seen an increase in overdose deaths from nitazenes. And then, Nevada's having issues, I think South Dakota too. But share your viewpoint. How do you view these overdose death numbers?
Yeah, this is, I'm excited that you're asking this question. It's one of my favorite topics and it's unexpected. So I love it. So While a lot of us want to celebrate the decrease in overdose fatalities, and of course it's good, of course the fewer people that are dying, the better. I, as an engineer and somebody who can look at data and understand curves and slopes of lines, I hate to disappoint people and say that it is less about the work that we were doing and more about a change in the drug supply. And a lot of people disagree with me on that. In the world that I work in, a lot of people want to tout that it's the harm reduction approaches that have been taken, the mass distribution of naloxone. And I certainly think all of those things are helping. They have certainly improved the numbers and decreased the deaths, but not a turning point like we've seen with the numbers that have dropped, in 2024, 2023 and 2024. The numbers that we're seeing, the percentages of overdose deaths going down is too big of a number for us to imagine that that's really all of our efforts. It's just not the way that change happens. It really is more indicative of a change in the drug supply. And I find a lot of correlations. If we look at like the DEA numbers of the potentially lethal doses of fentanyl and just the pills that they collect, I think it was like a 23% change that we've seen in 2 years in that number reduction. And so I think we're seeing less fentanyl, which is more immediately deadly in the drug supply. We're seeing less fentanyl deaths. And that to me is what's driving the numbers down, which feels like good news. But for me, it concerns me because as the numbers go down, the attention towards the issue also goes down. I think that people misinterpret why the numbers are going down. And all we need, if we don't fix the underlying problems, all we need is a shift in the drug supply, again, to drive the numbers back up. And so unless we make durable long-term changes to the way that we're responding to the epidemic, we're not going to see those big reduction numbers that we want and need long-term. It's always going to be the drug supply driving the numbers. And that's just my take on the situation. And I've done a lot of research and found a lot of correlation related to that. And so those are my thoughts on why the numbers are going down.
I very much agree that people, when they see numbers going down, they go, check mark, problem solved. Next problem, moving on.
Yeah. Yeah.
When we've seen overall throughout the decades, just drug use and deaths go up. Even though we've seen this decrease doesn't fit the overdose deaths of the 80s. It's just massive in our society. So there's a huge underlying problem with the demand side and people using. And the bad guys are always going to think of other ways.
Yeah. Agreed.
Well, so let's talk about, since you testified in front of Congress, some of your policy recommendations. I think you're promoting these under the Trail of Truth. Am I correct on that one?
So I'll give a little bit of background to help listeners know the difference. So I formed the organization Truth Pharm. Truth Pharm is a lot of things. We're a direct service provider in our community. We're an advocacy organization. We create innovative solutions. We're really amazing educators. And we're very much a harm reduction based organization. So we believe in and support all things harm reduction. The Trail of Truth is a memorial event that we've had at home. Yes. We had our 10th year this year in Binghamton, New York. But when we took the project national, we were really intentional about wanting to create a space that would be welcoming and feel safe and feel like a place that that people from all sides of the spectrum of deaths due to substance use related causes would want to be in. One of the things that I've seen in the course of doing this work over 11 years is, incredible fracturing of the communities who are impacted by substance use. And so we very rarely work together towards solutions that make sense.
Sure.
Instead, it's like, well, I believe in harm reduction, but this other person doesn't. So then we don't work together at all, which I personally think is ridiculous. Like, I feel like there's a lot of middle ground and a lot of things in the middle that we probably both support and want to get done. And so when we took the Trail of Truth National, that's what we did, was we really focused on what are the things that we all agree on. And I had my own personal feeling and sense of what they would be, but I wanted to verify it. And so I did some surveying on some social media Facebook groups, but then we formalized this survey and we've been issuing it nationwide. We have like 4,000 answers collected now. It asks one question: what do you think should be done to end the overdose crisis? And it gives like 42 options, all the way from, decriminalization to lock everybody up who uses a drug. It's like every single option in between. And the things that rise to the top are what we advocate for at the Trail of Truth. And the things that have risen to the top every time I look at the data is immediate access to treatment, which is pretty appalling that we don't have it yet, 14 years into this epidemic. But immediate access to treatment, ending medical discrimination, broad barrier-free access to naloxone. So those are our three primary advocacy asks related to the Trail of Truth. And then we added in responsible and transparent spending of the opioid settlement funds, because we believe that funding is a path to get the other three things. And so
you're not the only one who focuses on the opioid settlement dollars. This
I
is
bet. I know.
Saying let's spend it the right way. And
yes.
It's interesting so far.
Yeah. So those are the policy asks that we focus on specifically with the Trail of Truth.
Okay. So what about your standard of care request for opioid use disorder?
Yeah, so that's related to the immediate access to treatment and ending medical discrimination, because what we know is if a person has an overdose, or if they just, they want to quit using heroin or dope or fentanyl, whatever it is that they're actively using, and they're in withdrawals and they go to the hospital, you would think 14 years into a crisis that they would be provided some sort of standard of care, but that does not exist. A standard of care doesn't exist. Like there's no published protocol for how a hospital should respond to a person who is overdosed, which we should all be really upset about that. We need hospitals. We need an actual protocol that hospitals have to follow, no different than for stroke victims or people who are, having chest pain or anything like that. They have a protocol for care for those. There's no protocol for care for an overdose, after an overdose, or if a person reports having withdrawal symptoms. And so we want a standard of care for those.
No, it's very important. And the emergency rooms have been overrun with this issue.
Yeah.
In the last 15 years.
Right. You'd think that they would want to work towards a solution that would help alleviate that stress.
Yeah, it's complicated. No, it's just all right.
Sure.
You would have to, you would need social workers involved, and
Sure.
but I don't. Yeah, it is the stigma that leads people not to want to deal with the issue.
Right. Yeah. And I don't know. We should expect more, and we should have more by now. The CDC declared this an epidemic in 2011. So I think 14 years into an epidemic that's taking the largest number of young people from us, any other issue would warrant the attention that it deserves.
Oh, definitely. So let's talk about mental health is health. because you advocate for parity laws. Would
Yeah.
you, one, describe what a parity law is
Yeah.
and discuss what the most effective strategies for ensuring that this isn't just a policy on paper, but a policy in practice?
Yeah, so what a parity laws are is they're intended to make sure that insurance companies and healthcare providers are providing equivalent care for mental health related issues as they do for physical or body related issues. I smirk because maybe someday we'll recognize that it's all the same. It's one whole person. So how is it? It's pretty wild to me that we've ever separated these forms of care, and maybe someday we'll also eliminate behavioral health care because I have an issue even with that term, and realize that is also in the mental health realm, and that
Sure.
we need to take care of the whole person. But parity laws are intended to make sure that we can have our mental health challenges addressed as equally as we do our physical health. And I'm sure that anyone out there listening would immediately think about the disparities there, that that is not the case. You know, a person can really be struggling with mental health and yet wait 6 months to find a provider, or their insurance limits the number of times they can see a social worker or whatever, you know. So we're still struggling with parity in the United States. Um, and to your question, how do we make sure that it is,
It's just not
you
going to
know,
be policy on paper, but truly implemented.
right? I mean, it's a great question. I think it's just really us constantly holding them accountable, because the
Mm.
reality is we have had parity laws in place. I want to say the first one was in, I think, 2004, but I might be wrong on the year. But it is that's federal, and it's been reaffirmed twice. During the Obamacare Act, they actually reaffirmed parity at that time. And then I'm in New York State, and in New York State, we have parity laws on top of the federal parity laws, and we
Mm.
still don't really have parity. In New York State, as an example, the issue became so apparent and so big during the overdose crisis that our Attorney General actually made a hotline to report insurance companies that were not
Hmm.
following the law. And so I think it's things like that. I think it's
That's a
educating people.
great idea, by the way. Good
Right.
for her. Was that Letitia? Who was
It
that?
was not Letitia. It was the Attorney General we had before, which I can't remember at the
Okay.
moment. But it's, yeah. Uh, yeah, I know I should remember who it is, but I don't. But yeah, it's something that's really important, because we tend to think that, oh, it's a law, insurance companies must be following the law, and then you find out, no, they really don't. they really they really try to
No, you don't say
what they can
that.
possibly get away with. And so um I think educating people on what the parity laws are, so that when they're denied coverage, they know that there is a recourse. They know that they can report it. They know that
Right.
that it's not accurate. They can appeal it and things like that.
What I like the 800 number because yes, appealing your health insurance is just a bureaucratic
Mm-hmm.
process where you feel like you'll never get a live person or a real person who has any authority to tell you anything.
Yep.
So potentially getting a middleman, such as your attorney general's office, to at least potentially look into it is just another sort of life raft being thrown to you. Because
Yeah.
it is hard. It's very hard for the average person to know how to handle all of this. And in the podcast we had just released last week, we interviewed Ben Flaherty, who has this film called Shuffle on the problem within the sort of recovery scams that are going on.
Mhm.
And it's so easy for some of these companies to bill thousands of dollars for basic urine tests, but it's
Right.
not easy for the average person to find good recovery that's covered.
Yeah. So true. Yeah. So true.
And that's the sadness about all of this.
Yeah, yeah, it really is. It's really unfair. And then on top of it, a family in crisis, um, having to do all of this it's just wrong. Those families are really struggling. They're desperate to keep their loved one alive. The window of opportunity when somebody asks for help when they're fully addicted to opioids, the window of opportunity is very narrow. And so
Sure.
if you can't find help rapidly, and if it's not going to be covered by the insurance rapidly, you're probably going to lose them until the next window of opportunity opens, or you lose them entirely because they die in the process. Um, and I really look forward to these really basic things being resolved. When I started this work, I thought that, oh, we'll fight for some changes. We'll get a bunch of really good changes made. These really basic things, would be resolved rapidly. And I'm so annoyed and so frustrated that 11 years in, and there's like these very basic solutions that are still not in place. And so, yeah, I hope we can solve them soon.
But you haven't given up.
No.
So you have tenacity.
No, yeah, for some reason it's yeah. Yeah, I keep wondering what will the win be that makes me feel like I've done enough, but we're so far from that.
So let's go back to this window of change and hope with someone who's suffering from opioid abuse disorder. Were both of your sons addicted to opioids or just Jeff?
Both. Yeah.
When did you see the window with either of them? Was there a window?
Oh yeah, lots of times. With my middle son, he was very young when he started, and his struggles were very apparent. Unlike Jeff's, Jeff's was under wraps, and I didn't know that it was going on. My other son, it was very apparent. Um, and there were times that he wanted help. And with Jeff, the same thing. There were several times that he wanted help. That one that is particularly haunting, and it ended up being one of our focuses of advocacy when after I lost him, was he came home and begged me to get him into detox. And his girlfriend at the time also was here. They were both wanting detox and begging and going through withdrawals at that moment, which is an awful thing to watch. And so I started calling places. I thought this would be simple, so I started calling places. And one of the places that I called, it was a local detox center. And they said, they asked a couple questions, and the guy said, well, first of all, I'm confused why you're calling instead of him. And I'm like, what do you mean? And he was like, he needs to be the one to call. And I'm like, well, currently he's vomiting, into a bucket while he's sitting on a toilet.
Right.
He's really sick. I don't know what the problem is with me calling for him. And he was like, well, he needs to be a big boy and put on his big boy pants and call us. And he needs to call every hour on the hour to remain on the waiting list. And I just couldn't believe it. It was like, there's no other health situation that I could think of where I wouldn't be able to call and say, he's right here. He's going to give you permission to talk to me, whatever,
Yeah.
Trying to make the arrangements for treatment. I have the insurance information and whatever. And it was such a huge barrier. And that time is an amazing example of, here we were actively working, trying to get them both into treatment. I was unsuccessful in doing that, despite, I can't even, probably 4 pages of phone call notes to places. And the two of them ended up disappearing. They just left and they got what they needed that reduced their detox. And so that's what people go through. They need help when they ask for it. And if you don't get them the help, they're going to go back to the streets, because that's where the solutions are for them.
How do you feel? I really want to know this, because now that you've put together a lot of people on the coalition of different sides, right? And I I do love Ed Bish, but he definitely has a political viewpoint.
Yeah.
And he knows that I say that. And he's a great American. But so there is, President Trump has talked about being able to commit people, like family members, could commit folks that have drug use disorders. How do you view this, Alexis?
Well, anytime I hear an elected official make that suggestion as a solution, I'm stunned that they don't realize that when we ask for the help, it's not present. And
Hmm.
so if the help is not available when we're asking for it, where is it that they're going to commit our kids to when we forcefully commit them? I'm just literally curious, like
Yeah.
with Truth Pharm, we still navigate people to treatment. We're a direct service provider. So if somebody comes into my office today and says that they want any type of treatment, any of the types of treatment available, if somebody comes into our office today and asks for that, it's still going to take me 1 to 3 days to connect them with that care. And we're experts at it. We're really good at it.
So
And so
1 to 3 days for you
still,
as an expert to help someone or a family help find detox and recovery.
that's right. Right. Right.
Yeah,
And it,
that is utterly ridiculous.
and in a state, New York State, that attempts to boast or tout that they, have one of the strongest treatment, systems in the nation. And so if our state has it the best, I can't imagine what people go through in states where there's very few resources. And our governor called for the same thing, by the way, as Trump. And I like to point that out because Governor Hochul's a Democratic governor, Trump
Hmm.
is a Republican president. And here they both are calling for this involuntary commitment to force people, lock them up when they, to make them get treatment when all these people are out here asking for treatment and they can't get it. But again, my question is always, where are you sending them? I mean, treatment isn't available when we ask for it. So where exactly are we committing our loved ones to? I fear that what the intentions are is similar to what Pennsylvania is doing and Kensington is doing, is when they don't have treatment beds available, they put them in the local jail. And there have been multiple deaths so far in Pennsylvania because there's no medical care for the withdrawals that people are going through. And people are dying literally just from withdrawals because they don't
Sure.
have the care that they need there. So that's what involuntary confinement is doing in Pennsylvania, is it's killing people. When really we just need immediate access to treatment nationwide.
Will you send me, or has there been news reports on this? Will you send
Yeah,
that so we can
yeah,
include that in the newsletter?
yeah. I'd be happy.
I do think there are some people, probably people who have been living on the streets and have been, gosh, just living such an inhumane life that it's hard for them to come back to making that decision. But we should see the plan, right? For
Yeah,
people to make a decision. And why can't, if I had a family member, why would it take me a day, 24 to 72 hours to get them into recovery?
right.
Great point. I wasn't even planning on asking this. And here maybe our conversation led to it. So thank you for those insights. Yeah, and Hochul, yes. And I think it's the mayor of San Jose, Daniel Laurie. They have a lot of issues, obviously, in the Pacific Northwest. He's supported this too. I'm open to it, but yes, I think details are very key.
Yeah, yeah. I think a lot of caring people um, who are really concerned for the downward spiral that they see in people's lives. When addiction takes hold and they become homeless, and it feels like their lives are abysmal. I think that a lot of caring people view this as a potential remedy, but
Mhm.
the details are extremely important. I think the very same people who see this as a potential remedy wouldn't be happy to know that people are being put in jail instead of treatment. And so I
Yeah.
think, the devil is in the details here. We need to ask those questions. Are there actual treatment beds to put people in who are going to be mandated to treatment? Because I'm willing to bet not. And we've got to make sure that we're not supporting a policy that is really just another path to boosting the carceral state and boosting mass incarceration, because it's not a solution for people. It's not what gets people well.
Sorry. And I don't think everyone is thinking, oh, let's boost the sorry, I've got something in my throat. 1 second. Matt can edit this.
You're okay.
I don't think everyone is thinking, let's boost the numbers in incarceration. They're just looking for solutions. So I think that's where some folks are coming from with this. But the devil in the details, or it just sounds good, so check mark,
Right.
which is sometime policy. But
Right.
okay, let's move on to your event coming up this September. Not too far, about an hour and a half from me in Washington, D.C. Do tell
Yay,
us
I hope
about
you're
it.
coming.
I'm going to try.
Good. I'd love to meet you in person. So the event is called the Trail of Truth, and it is an enormous memorialization project. We do typically have these advocacy goals. We are actually not focusing on advocacy this year. For a lot of reasons. We think the political climate is a little rough, to say the least. And a lot of families have concerns about traveling to DC, with DC in the current situation that it's in. And so we wanted to make sure that this year the Trail of Truth is that there would be no way for people to view what we're doing as activism or advocacy, so that there should be no negative response to our gathering. The gathering will
Sure.
look like families gathering, healing, supporting each other, and memorialization, not as activism or advocacy, so that we can just have some peace together. And the event will be incredible. We have our memorial format, our tombstones that we have painted all across the nation, and we call it a community arts installation because it's truly built by the community, everywhere in the United States. And then we bring these memorializations together. They look like tombstones. Our memorialization display is 3,800 this year. So the pictures that people see from the first year, 2022, that have appeared in national media outlets, that was 1,200 memorials. So it's going to be triple that size. It'll be huge. Then we've also collaborated with several other partners who are bringing their memorial displays. So in all, there'll be 7,000, over 7,000 memorials represented. So it'll be a real vast display. And, we're really intentional about making sure that we create spaces that are healing and supportive for families, where they can feel safe to talk about the challenges that they've had, build community with each other, and have healing activities. So we have like grief share groups, we have artful activities that people can engage with. And yeah, it'll be a really powerful, meaningful time to build community and to show something that I think is really important. The most important thing really is that we can show that we can build unity across the political divide. This is an issue that people love to say it's not political. People love to say it affects the right and left.
Sure.
But very few people are building a space for those people to exist. And that's what we really set out to do with the Trail of Truth, is to build a space where we really can have unity with people who think differently from us.
And it's on the National Mall?
Yep. It's on the National Mall between 9th and 12th Streets. Actually, 7th. We got it expanded to 7th Street. So 7th to 12th Streets on the National Mall. and it's going to be powerful and beautiful. From 11 a.m. to 4 p.m., we'll have a lot of activities that I just described. And 11 a.m. to 7 p.m. is the display. And then 4 to 6 p.m., we have speakers and performers, which is always a real, it's just a real powerful time for people to hear
Mm-hmm.
from people who have direct lived experience. We have no political figures speaking this year at all, no elected officials, which I'm really proud of. I feel like it's time for them to listen. I think they use things like this as a platform and an opportunity. But I think it's time for families' voices to be heard.
I think that's beautiful. So memorializing over 3,800 people lost to overdose.
Yeah.
And wow, so moving. Well, Alexis, please tell our listeners where they can learn more.
Awesome. Trailoftruth.org is the easiest place to learn about the Trail of Truth. We're also on social media on Facebook, Instagram, and TikTok. And people can reach out by email. They can submit a loved one on the Trail of Truth website. They can join us as partners on the Trail of Truth website, and reach out. We love to build community with people.
So wonderful. Thank you for joining the Poisoning Podcast, Alexis.
Thank you for having me. It was a pleasure.